were stayed out of the hospital more than people that didn't have house calls.
That's interesting. Why do you think that is?
I think it might be because of the personal aspect of it, and people take a greater concern about what's going on with themselves if I'm coming to your house to treat you.
Mm-hmm. So let's talk about some of the common sort of ailments that you see, especially in seniors. Let's focus on the senior crowd tonight. What are the typical kinds of ailments and foot-related problems that you see, both in house calls, and we can expand it to the entire population of seniors too? What are the typical sorts of problems that seniors have?
Well, a typical problem that seniors have is, of course, primarily diabetics. Diabetics have less sensation in their feet. They're more susceptible to infections. They're more susceptible to thick fungus nails, which are yellow and thick nails. And they also have more problems with their skin. Mm-hmm. Another common problem is circulatory problems. As people get older, whether they're diabetic or not, their circulation is affected as time goes on. So there are certain things that you're going to see in the elderly population that you don't see in younger patients, okay? And also, if a patient has a foot deformity that they have not had addressed surgically by a podiatrist, they're going to have some conservative type of problems, corns and calluses, dry skin, blisters, and different type of things that happen to their feet, but they just come along with the normal aging process.
And typically, what kinds of treatments can you actually provide in the home for some of these? Let's talk about the diabetics, because it's a very serious sort of group of patients.
Okay, the main treatment for a diabetic, it primarily is to educate the diabetic to know exactly what's going on with their feet. They know that there's certain sensations in their feet that are normal for diabetics. Mm-hmm. There's certain things that are going to happen with their skin. There's certain rashes that are fairly normal with diabetics. A diabetic will normally be more susceptible to fungal infection in their toenails. Mm-hmm. And also they will also be more susceptible to swelling if they have some heart problems that go along with the diabetes. So mainly, the diabetic in a house call to a diabetic is more of an educational type of situation, mm-hmm. and a treatment modality right on the spot.
Mm-hmm. We're talking with Kirk Contento, a podiatrist here in Illinois. We're talking about house calls for people with foot care problems. Feel free to call in your question with him, or if you want to find a podiatrist that will make a house call in Chicago, you can call the 800 number on your screen there, or visit our website at IPMA.net, and there'll be a list of members that provide that service, right, Dr. Contento?
Sure.
Okay. Now, let's talk about some other ailments that you see that are common besides problems that people with diabetes suffer from.
Also, a patient who's not a diabetic will normally have a problem with the length of their toenails, and they can't bend down to cut those toenails. Mm-hmm. So a lot of times you'll see patients who have very, very long nails. I remember when I first got out in practice, I was working in a podiatrist's office in Brookfield, and he asked me to go make a house call on somebody, and I went to go make the house call, and when I was waiting at the door, I heard clicking as the person was coming to the door. And when I looked down, this gentleman had toenails that were going over the tips of his toes, and he's walking on the toenails himself.
Wow.
Now, the reason why he called was not because of the length of the toenails. He called because he was actually stepping on the toenails that were curving over the tips of his toes and digging into his skin. And so what had happened is that the toenail itself had cut into his skin, and he woke up and his sheets were bloody, and he didn't know what was causing it. So somebody said, maybe you should call a podiatrist. Yeah. And when I got there, he didn't think it was abnormal for him to have nails that went over the tips of his toes, and then he was walking on the tips of his toenails. So usually, long nails, and usually where their shoes rub, because lots of seniors don't know, they think they still wear the same size shoe they had when they were 20 years old, when they're 80, and the foot does change as you get older. So when there is some rubbing on the skin, you're going to get some hard callus tissue that's going to form, and usually in that situation, that hard callus tissue holds heat longer than normal skin does. So the complaint when they call me is, I have something on my foot and it makes my foot hot, and I don't understand why my foot is hot. So then when I come into that situation, I'm able to assess what's going on and say, well, you know you have a callus here on the side of your big toe because the bone is sticking over and it's rubbing on your shoe, and that callus tissue holds heat longer than normal skin. Well, they don't realize that that's what the problem is. So all you have to do is trim off that callus tissue, and they're relieved.
Yeah. Now, elderly patients that are in sort of assisted living centers or nursing homes, can they request a podiatrist through their caregivers at their homes too?
They certainly can. They certainly can. They can request the care of a podiatrist. In fact, I advise everybody who lives in that type of situation to at least request a podiatrist to come in and evaluate you. You may not even know that you have a problem with your feet, and if the podiatrist comes in and evaluates you, at least he'll be able to educate you as to what you need to do to prevent it. He can put you on a set type of schedule so that you can maintain your problems and not develop into bigger problems. The whole idea in all of medicine is to prevent things. If we were concentrated more on preventing things rather than treating things that we see after they already happen, it'll make our lives and the patient's lives a lot easier.
What about shoes and seniors? You probably have seen a full range of shoes. Most are probably fine, but you probably see a lot of shoes that are probably contributing to the problem that the senior's having. Talk a little bit about sort of what shoes seniors should be looking for.
Well, seniors should be looking for shoes that have at least, as far as the length of the shoe, a thumbnail's length between the end of your longest toe. I used to say the big toe, but then I realized that a lot of people's second toes are longer than their big toes. So
Right.
there's a thumbnail's length between the end of the shoe and the end of the longest toe. Another key that I always tell my house call patients is if you can bend down, and that's sometimes a trick in itself, and grab a little bit of the shoe from the outside, right about 2 inches back from your little toe, and pinch some of the fabric, whether it be leather or synthetic or canvas, just so you can pinch some of that fabric. Now, the reason for that is as you walk, whether you're a senior or not a senior, your foot will elongate, get longer and wider. The problem is as you get older, your foot gets longer and wider a lot quicker than it does when you're younger. So people don't realize that as they're walking, if they buy a shoe and they're too big, their longest toe is right on the end of the shoe, and then they're walking in that shoe, they're going to probably develop some kind of problem, a sore or a callus on the end of that toe that could turn into a sore, or if it's rubbing on the outside because they don't have enough room because that foot is getting wider and longer every time they step down. Now, sometimes people I see in house calls are still wearing the shoes they wore when they were 35 or 40 years old, and they're 70 and 80 years old.
Wow.
And they can't understand why their feet are hurting. They said, well, why do my feet hurt? And I said, well, you see those shoes? I said, I bet you can't get that shoe on without at least losing your breath or perspiring. And they can't. They can't get their shoe on. So they're jamming their foot into a shoe that's way too small, not wide enough, and they're only causing more problems. I mean, that's job security for me, actually.
Now, there are also sort of aids or tools that are sold to help seniors get their shoes and socks on and off, right?
Yes, there are.
And talk a little about those, because my mom has used these. She had a hip surgery, not foot problems, but I saw her using these because of her hip. But I thought, wow, people with foot problems could probably benefit from those too, right?
Yes, they can. They have all different types of devices to help you. It's like a modified big long shoe horn that helps you get into your shoe.